One of our health coaches is an LPN, and she has just been one of our biggest drivers of this project. We've been so excited how she's adapted and worked with her population. She's in a rural clinic, and she understands that really her role is to take the burden of work that is non-physician work off the physician. So as a nurse, she does the nurse things, lets the physician do the physician things. So as part of that, she's really encouraged that interaction, the working with the patients with the decision aids, and she's actually set up a DVD viewing station in her clinic since people are coming in with knee and hip osteoarthritis, they're retired farmers, they may not have the DVD players at home or something like that. So people come into the clinic, they have a little bit of mobility issues anyway. Here's a one-stop time so they can see the decision aid, and they get the worksheets and they can either fill them out then or mail them back later. She really understands her community. She is getting the word out about decision aids. People approach her at the grocery store or wherever where they know her and they've heard about this and they ask about it for their relatives, their friends. And she's just such a champion for it. It's very exciting. And the work that she does frees up the physician. They're not repeating the same stories over and over as far as the risk benefits, which we know that's all good and important, but she's able to take some of that load off, and by sharing the DVD, so the patients are informed, and it's then at that visit, and it's just been a really good project. We're so excited for her because she is really leading the way and getting very appropriate DVDs to people at the right time. Well, one of the things that we found with our providers when there's a chronic issue such as menopause, that it starts feeling like the same old thing. You talk with a patient, you discuss symptoms, how to cope with them, different options, and it may be 20 or 30 minutes it adds on to the visit, and the provider leaves feeling like after about the 5th or 6th one that day that I'm saying the same thing over again. Is this really value added? And what we discovered in one of our practices that's has predominantly female physicians, that having the decision aids saved 20 minutes on a visit, that they felt like people were getting the information in a very unbiased manner, and they were getting their answers to their questions, very personal questions and things that maybe they wouldn't ask in a visit even with a female physician. They were able to go home, watch the DVD privately, think about things, and come up with solutions that fit in with their lifestyle and their values. So we found that very valuable, and it really helped with the buy-in. Actually, we're using that, the menopause one, as an opportunity to gain buy-in at some of the other clinics. Because I mentioned in our presentation that we need to have enough of these flowing through the clinic so that there's a habit formed. So people are used to the decision aids, they think of them, and if it's just a knee or hip osteoarthritis that might be showing up once a week, there's not a habit. Menopause, we're seeing that a lot in all of our clinics, so this helps that introduction. This is saving me time, this is value added, and so we think that's very exciting. Okay, one of the things that we discovered was many times as we add new processes in our clinic that to get buy-in, people need to see the value added. And the menopause videotapes really helped with that because the physicians, the providers were using the same scripting over and over again during the course of the day. They needed the opportunity to be able to hand off that patient education component, decision-making component to someone else or through the decision aid. And what we found that was really helping was introducing the menopause video gave us a chance for a habit to form. They saw value in it, they were able to use it, and it then became part of the habit, part of the process within the clinic. So we found that very helpful. Plus, it shortened up their day. Physicians were able to schedule in 1 or 2 more patients. They work within a fee for, or a virtual private practice, so it affects their productivity. They're more productive, they're happier, because they're getting to do physician work instead of having to do what may be perceived even as nurse work. So it's been a really a very valuable addition to our practices. One of our just star performers is a health coach that's an LPN, and she works in a rural clinic. And Iowa is known for having a lot of very elderly people in the rural populations. We're just known for that. And so she sees a lot of people with knee and hip osteoarthritis. So people are presenting with mobility issues to begin with. They may be coming 20, 30 miles to visit her. And so what she does, or to visit the provider, she offers the decision aid that day when they're considering having a total hip or knee surgery. And what she's doing then is offering that DVD. They have a DVD player in a quiet area. There are posters that surround the carrel where they sit and watch the DVD. And it shows the anatomy of the hip or knee joints. And they're able to ask questions of the health coach, fill out the worksheets at that time, and really have the chance to have a total package as they come in and visit about those knee and hip osteoarthritis concerns. And what's really neat too, she lives in the community where she works. People approach her. She had people approach her at a Bible study, at the grocery store. They're just friends and relatives that know what she does. It's a small town. And they say, well, we have this situation or that situation. Can we see the DVD on the spinal stenosis or the herniated disc or the back pain? And so word's getting out, and people are now approaching her about these decision aids. So it's been very exciting. Plus, it really helps the doctors, because they're not having to explain all the risks and benefits about the surgeries. And it's giving that opportunity for the patients to think about things on their own. And it's helping the physicians with their productivity. They're able to see more patients, not spend that time on the instruction, but they know there's good quality instruction happening with the decision aids. It really helped buy in hugely.